And actually, when I was doing some research myself into chronic fatigue syndrome previously, it was amazing how often the question would arise of, is chronic fatigue syndrome genuinely a condition? Is it a real thing? Is it psychosomatic? Is it, and it's such an awful thing as somebody going through these symptoms, experiencing these really, really distressing symptoms that's just completely changing their life, to then be questioned by so many people as to whether they're making it up and whether it's all in their head. So, this is where people like yourself and other practitioners in the field who do take that time to try and understand how they got there. And like you said, the mechanisms, it's crucial. So thank you for sharing that. I do actually think that this is one of those conditions as well where you quite often hear people say, it all started from this point and I've never been right since. I've never been right since. I always think that's an interesting one to hear. Is this something that you hear often when it comes to chronic fatigue syndrome?
It's absolutely essential. And whenever I take a history from a patient, I always ask the question, when was the last time you were fit and well and healthy? Because that gives us very good clues to causation. So, for example, if somebody says, well, I've never been well, ever since a child I've been ill, then it's often allergy. And the commonest allergen in childhood is probably to dairy products. As you probably know, we're seeing epidemics at the moment of type 1 diabetes in children because we're having far too many dairy products. We know vaccines switch on autoimmunity, and vitamin D deficiency is a risk factor for inflammation. So yes, always ask the question, how did it start? What were the circumstances of that? Because that gives us a very good clue. Now, one of the most common forms of presentation is somebody says, well, I was never terribly well and I had tonsillitis and ear infections, which makes me, oh gosh, dairy allergy again. And then I went to university and I got glandular fever, Epstein-Barr virus. Now, I have to say, going to university is a very dangerous thing to do because when you go to university, it's stressful. The food is often awful because often these kids are away from mum's good home cooking and they're trying to do for themselves on a low budget, so they're eating cheap with pasta and cheap carbohydrates. Their sleep is disturbed, they're often staying up late at night, they're stressed by the work that they're doing, and so on and so forth. And all those things predispose to. But the last straw is picking up that nasty little virus, Epstein-Barr virus, glandular fever. And if they can't deal with that well, that will flip them into an M.E. Now, M.E. is, as we talked about, that's poor energy delivery mechanisms and inflammation. And if the body cannot get rid of or deal with that virus quickly and efficiently, it becomes chronic. And this is about a fifth of the patients who come to see me with M.E. That is their history. But it can be any virus. Any virus, especially in stressful circumstances when we're least well able to deal with that virus. Or worse than that, we have to push on at work for some reason or other. Now, if anybody gets an acute infection, and it doesn't matter what that infection is, we should give the immune system the energy that it needs to deal with that. And that means we should rest up, keep warm, and do not symptom suppress with medication. You might feel better in the short term with symptom suppression, but that stops the immune system fighting the virus. If you've got an infection, we want to run a temperature. We want to feel ill so that we go to bed and wrap up warm and run an even better temperature. We want to cough because that physically expels it. We want to vomit, have diarrhea, sneeze because that physically expels the virus and reduces the loading dose. And all the symptom suppressing medication that's out there on the market stop us having those essential symptoms that allow us to deal adequately with that virus, whatever it may be.
That's well explained. I personally, I always ask, especially my younger patients, or if the parents are bringing them in, about their fevers and, how high a fever do you run? Because generally, obviously there's a safety point here, but, sometimes those higher fevers are actually shown to be beneficial. It's a good sign of their vitality as a person. And like you said, when you suppress these things, what are the implications? And I guess then when you add on to it somebody with a diet that's rich in refined sugars, what's that going to do to the immune system? Just suppress it even further.
Well, it's worse than that, because many of these microbes thrive on sugars and carbohydrates. And one of the things I hate to see is hospital patients surrounded by fruit, grapes and melons, because that's high in sugar, and that feeds any infection that they may have. In fact, quick example of this, I remember I had a patient who came to see me, a young girl at university who had huge boils and carbuncles in her armpit. She'd had all the antibiotics intravenous, she'd had surgery, and the infection was literally invading her armpit. When I took a good history from her, she was a fruitaholic. She was living on fruit, and she was just feeding that infection directly. So we stopped her fruit, gave her a ketogenic diet, some good nutritional supplements, topical iodine. I love iodine. Contact kills all microbes, and within 5 months, with no antibiotics, she had completely healed.
Wow.
So it's a lovely illustration how sugars and carbs feed all infections. And again, another little